Hello and welcome to SoftIQ Technologies. In today's video, we will be looking at Odoo Hospital Management System. Odoo ERP is a suite of integrated business management software with modules for hospital management, helpdesk, accounts, fixed assets, purchase, inventory, POS, sales, CRM, among others. Below are the key modules in the Odoo Hospital Management System. There is a hospital management module. Then there is an inpatient administration module, there is a pharmacy module, then there is a clinical services module, then there is a finance module. Next, we are going to jump straight into the system. So before we start using the system in a HMS, we need to set up some few settings. For example, we need to come here and capture things like the doctors, also known as the physicians. So you can come here and capture each doctor, capturing their specialty and also for example the institution where they work. The next thing you need to capture is say for example this hospital can have several health centers, so you can capture each health center. Maybe you have a health center in one town and then in another town, so you can capture each of these health centers. So for our situation, we are going to handle one health center called MediHub Hospital. Then after you set up the health center, you can set up the buildings. So say for example your hospital can be broken down into, there's the main hospital block, there's a diagnostic center, there's a pediatric wing. After you set up the buildings, you can then capture what we call, for example, the units. Now in these units, for example, you can capture there's an outpatient department, there's an inpatient ward block, there's a radiology unit, which if you go inside, you'll find out that this one is inside this health center. Next, after you capture the units, you can capture what we call the wards. And now in the wards, we can see now we have like the male medical ward. And in each of these wards, you can indicate how many beds there are. For example, the male medical ward has 20 beds. You can indicate what other features the male medical ward has, for example, air conditioning, television, internet access, and such. And also you can indicate which gender is supposed to go to this ward. After you set up the wards, the other thing you can do now is capture the beds. So in each of the wards, you can be able to capture each of the beds. So say for example, this bed, you can also capture maybe it's what type of a bed, and also the status. After you do all these settings, the other thing you need to do is say for example you can set up the medication. So medication like medicaments, you can come here and say this medicine it's for which therapeutic effect. So it's in the category called antihypertensive, and it's for lower blood pressure. So you can also capture the active components, expiry dates, and such. So you can also do to capture things like the presentation, composition of the medicine, the dosage. If at all it's not safe for pregnant women, also you can indicate. Any adverse reaction you can also capture, storage conditions, and any other extra information. So after you do all these setups, the other thing you can capture is things like diseases. So you can capture each of these diseases, and they can have a disease category. So now once you finish these setups, you can begin now using the system. So the first area we're going to look at is patients. So when a patient walks into the hospital, they can be captured into at the triage. So you can create a new patient. Say for example, a new patient walks in by the name of Stanley. You can create this patient, and you can capture details like phone, mobile, email, and such. And then you can indicate here under medical that this is a patient. And then in the triage, you can capture their date of birth, assuming they're a new patient. So if they're an existing patient, you can just pull up their file. So for now, I'll just say this patient was born in 1992, July 24th. You can indicate the marital status. You can also indicate the sex. They are now 33 years. You can proceed to capture any patient critical information, and I mentioned things like the contact information. Then you can capture things like the blood type. So this patient is O. You can capture their category, let's say African. If they are being treated under insurance, you can capture the insurance which they'll be using. Then in the triage, they can capture things like the pulse rate and oxygen rate, blood pressure, weight, things like rhesus factor also you can capture. For now, I'll just, if there's any patient extra information, you can capture here. Then if you want, you can also capture the patient image. So if they are okay to give you an image, you can be able to capture an image. And then you can save this. And also if you want to print, you can print out the patient card. So an example of a patient card looks like this. So we can see here details about the patient, the blood group, date of birth and such. Now, once the patient has been captured as a patient, you can be able to send them maybe for the finance office to pay a consultation fee. So you can just come here to appointments and create an appointment for this patient. So we're going to create a new appointment, choose a patient. And you can indicate here which doctor they're going to see. Maybe they're going to see a general practitioner, Dr. Helen. And then you can indicate the appointment date. So it's just for today. It should be done by, let's say, by 5. And also you can indicate whether it's inpatient or outpatient. So for now it's outpatient. We are going to invoice them. The health center we mentioned, this is MediHub. Duration, this is a 1 day. Urgency level, you can indicate whether it's normal or urgent. So for now it's just normal. You can say invoice to insurance. The insurer is Jubilee. And then we can indicate a consultation service. If everything is okay, you can save this appointment. Now, once they go to the cashier can be able to come here and create an invoice. So this is just an invoice for the consultation. For example, this is going for around $20, and then there's a VAT. If everything is in order, the cashier will confirm this invoice, and then the patient can be able to pay. So when paying, they can indicate whether they're paying via cash, M-Pesa, check. So for now we'll just say cash. Then we can create the payment. Now once we create this payment, the invoice automatically shows as paid, and we can be able to print out a receipt. So this is how the payment receipt should look like. Ideally, the patient is going to go back with the receipt now to go and wait to see the doctor. So we can see a sample of the receipt. So this shows this customer, or rather this patient, Stanley Wesonga, has paid for consultation an amount of $23. There's an invoice and the receipt. They don't have any amount due so far. So now once the patient goes back to the doctor will just come here under patients and be able to come here and just go through what has been captured, the oxygen rate, the blood pressure, and then now they can be able to capture any information. So patient has a fever and is a bit dizzy, for example. So once the doctor sees the patient, they can be able to recommend maybe to send this patient to the lab. So from here, the doctor also can be able to refer back to historical data about this patient. So if there are any diseases they have been treated with in the past, will appear here. Any outpatient that has ever happened will appear here. Any surgeries that have happened, any generic risks, socioeconomic, say for example things that are in the family line, lifestyle. The doctor will be able to pull all this information, including things like addiction and other information. Any lab work that has ever been done will appear here. Medication history, any vaccination which have been done, any lab work or imaging for x-ray and such, any other attachments also. So the doctor, for example, will just come here under lab tests, and they are just going to create a new lab request for a full blood count. So this is Dr. Helen who is asking for this, and they can be able to save this. So now the patient will proceed to go to the lab. Now the user in the lab, when they log in, they'll be able to come here under laboratory and be able to see any lab requests. So by default it comes here as a draft lab request. So they'll come here and see Stanley Wesonga has been sent to do a full blood count, and then they can be able to ask them whether they are paying by insurance. So they can be able to capture this, and the test being done is a hematology. The insurer, as I mentioned, is Jubilee. If there is any policy number, so they can be able to now come and create a lab invoice. So the cashier at the lab can be able to create a lab invoice, and now this one appears like this. It shows a full blood count. It's being charged $40 plus VAT. So they can confirm this invoice, and the patient can be able to pay. Now this one they can pay also via cash, and also same situation like the consultation, they can be able to be given a receipt. So this is a sample of the payment receipt for the lab. If the hospital is purely paperless, all this information can just be sent on email to the customer. So the system also integrates to email and also WhatsApp. So we can see here this is a payment receipt. Now now that the patient has paid for the lab, the lab person is going to come here and create a lab test. So they'll create this lab test where they'll be able to feed in the results of the lab test. So they'll create the lab test like this, and then now if they come in here and so they'll go now do the lab work, and then once the results are out, they'll just come here to lab test results, and then from here they can be able to come and so basically in the system you can set up for each test what are the normal ranges. So say for example the hemoglobin of this patient comes out as 15.7. The red blood cell count is okay, normal is up to 5.2. This hematocrit tests comes out as 60, and the total white blood cell count comes up as a bit high. So let's say for example it comes up as 12,000. So now this lab person can be able to put these results here, and if there's any other information they can be able to give their comment also, and leave the doctor to give their diagnosis. So they can just put a comment in the results, and then they can save this, and they can be able to print out this lab result for the patient so that they can go back to the doctor. Okay, so this is the lab report. It shows that Dr. Helen asked this patient to come for a lab work, and the outcome of the results. So we can see here that the white blood cell count is a bit high, and also the hematocrit is also a bit high. So the lab engineer can also sign here, and now the patient goes back with those results back to the doctor. So the doctor will just come back here, and that document for the lab can be either scanned and put back in the system, so that when the doctor comes back here, they can either look at the physical document, or they can come here under attachments and see any lab document. For now, we're just going to come here and see. Okay, so the doctor goes through the lab results, and they're able to find out that the patient has, for example, the patient has malaria. So, has malaria. To begin medication immediately. So the doctor can come here and put the medication that the patient should use. So here under medication history, they can come here, add line, and say that this patient is supposed to start this medicine. So the physician is Dr. Helen. Indication is it's malaria. They are going to begin the treatment immediately. It's a treatment for 1 week. So also they can indicate it's going to be used in what kind of route. So it's oral. They can indicate it's a dosage of 5, and it's 5 mLs. Treatment duration is 7 days. Treatment period, days. Frequency, they can indicate 3 times a day. All this information the doctor can be able to fill. And then now this medication, the patient can be able to go to the pharmacy. So the doctor saves this. So once the doctor finishes writing the medication for the patient can go to the pharmacy, and the pharmacy can be able to print out the medication history. So this report is able to show the pharmacy the medicine that the doctor prescribed. So we can see that this patient has been told to take this medicine, and the start date and the end date. So now from the pharmacy, they can be able to proceed to invoice the client, and the client pays, and they go home with the medicine. Now the next situation we are going to look at is a situation where, for example, maybe the patient they want a prescription in case the medicine is not in the hospital. So from that, you can just come here under prescriptions. You can create a new prescription. So for the same patient, let's say for example Stanley. So the prescription is from this pharmacy. The prescribing doctor is still Dr. Helen, and this one can be either invoiced to insurance, or if it's not being invoiced, you can just leave it as that. So you can capture the medication the patient is supposed to get. Okay, so indication, that one you can leave it as that. Allow substitution. It's being given by oral. Start date is today for 1 week. And then dosage is 5 mLs. Frequency is 3 times a day, and such. Now, once you create this prescription, you can be able to print out the prescription, and the patient can go and buy it in any authorized hospital or clinic. So this is how the prescription looks like. So it shows the medicine, the dosage and such. And also this can be signed by the prescribing doctor. Now the other area we can look at is say for example maybe a patient who's being admitted as an inpatient. So you can come here and create the patient. Maybe there's a patient by the name of Susan. So this patient is being admitted under maternity. So the date of birth is 1989, May 28th. She's married. So any other information during capturing of this patient, it can be captured here. Blood type, she's AB. She's being covered by insurance. You can capture any information that is available. So once you create this patient, you can be able to come here and under Inpatient Administration, you can begin the patient hospitalization. So you can indicate here the patient, that is Susan. You can indicate in which bed she's going to. So she's going to the maternity ward. You can see here this bed is free. So she's being hospitalized today, and ideally the discharge date can be like 3 days. The attending physician, you can look for one of the doctors. Let's say for example it's just it's a GP who's admitting her. The operating physician is still the same. Admission type is maternity. Reason for admission, maternity ward. And then you can be able to save this patient hospitalization. You can confirm this registration. So when you confirm this registration, it's going to move from the free to confirmed. And then you can proceed to patient admission. So now the patient has been admitted. If there's any information, you can be able to capture here. And from here, you can be able to print out the patient visiting card. So this is just an example. So this patient is being admitted to this bed BD12. So if she has any visitors, you can be able to issue to the visitors. So under this patient hospitalization, so in case maybe for whichever reason, maybe she needs to go to the ICU or any other inpatient facility, you can be able to proceed. But if it's just normal admission, after she's done with the delivery, you can just come here and say discharge patient. Once the patient is ready to be discharged, you can come here and say discharge patient, and you can also print out the discharge sheet. So thank you for taking the time to watch this video. We welcome any questions or suggestions, and if you'd like us to set up a Odoo hospital management system for your healthcare facility, feel free to contact us, and if you can subscribe and like our page, we will appreciate. Thank you.